Okay guys, the second station will be the whole bronch portion. So the very first step within the bronch portion of your midterm is just a regular nebulizer treatment. It'll just be, instead of albuterol or Duoneb, like we normally give, we will be giving lidocaine during this treatment. This helps numb our patient's airway. So it's the same exact procedure as any other nebulizer treatment, just a different medication. So I'm not going to go over that process. You guys should know that, but it's the same. Knock, knock. My name is Lauren. I'm from respiratory. I'm going to give you a breathing treatment of lidocaine. It's just going to help numb your throat. You're going to check your patient's vitals, including heart rate, breath sounds, respiratory rate, and SpO2. You're going to document all that stuff. And then, again, using just a little saline bullet, put 3 mLs of solution into a neb, turn it on, show me that's running, and that'll just be your first step under station 2, which is the bronch. The second step is setting up the bronch scope. So I'll have this scope box sitting out on the table when you guys come in, along with all of your other supplies that you guys will need. So for this portion, the port adapter and your suction adapter, normally these two things are disposable between each patient, and you have to put them on. I don't have enough to do that for each of you guys, so these will be already on when you guys start, but in real life, these normally you have to put on. So the first thing you want to do is plug your actual scope in. So you're going to take this end, and it goes into this top box. So you just line up the big and little prongs with the big and little holes, and it just slides in. There's also this little knobby guy on the side, and you'll see there's a little notch in the port that it lines up with. So that just slides straight in. You'll kind of hear it and feel it click in. You can kind of pull on it just a little bit, and it should be fairly secure in there. Again, the newer bronch towers have an actual little spot that you can set your scope in so it stays hung up like this. Remember, you want to try and not touch this on anything. You want to try and keep this portion of your scope as clean or sterile as you possibly can, because again, this is going to be going down your patient's airway, and you don't want to cause any contaminations or potential contaminations. So typically you hang it up. Since there is no little notch on this one, just set it wherever you can. Okay, so after you plug in your scope, then you're going to set up your suction for your scope and for your patient. So remember, we want both oral suction, and then we need suction for the actual procedure. So over here. So all of this will be taken off. I will have it all again sitting on the table. So you're going to need two different suction lines. A Lucan's trap and a Yonker. So of course, I'm sure you all know how to set up oral suction. I'm going to take my suction tubing and my Yonker. I will have the actual suction canister hooked up to the suction. You guys just have to set up your lines off of it. So you're going to plug it into one port and have that ready to go. And then usually I tuck this underneath the patient's pillow or something like that, so it's ready to go. And then scoop this guy back. Your suction that you will put on your actual scope. So you take your Lucan's trap, the little rubbery adapter that comes with it will hook up to the end of the suction port on your scope. And then you just take your one end of your suction line, hook it up to the other little cap or port, and then you take your other end of your suction and obviously plug it into your suction canister. I don't have it yet, but I'm hoping to have it by the final. But normally in real life, we have these little blue, like Velcro strips that you would then attach your Lucan's trap around your scope. That just kind of secures it. It makes it so this can't, pop off accidentally if it's, being swung around. So hopefully I will have that by then. One thing you have to be aware of, this is very malleable and it gets kinked really easily. So obviously if it's kinked, your suction's not going to work properly. So you want to make sure that that does not get kinked. You can actually put one of these suction lines from here and use an adapter in between this blue suction port and this guy, the end of your Lucan's trap, if you want more slack, essentially. Or if you don't have that blue Velcro. So, secure this. And then this is all you have to do for your suction portion and your setup for your actual scope. In real life, if you have a scope that actually has a working light, you'd want to ensure that your light is functioning correctly, that this does move, that it's operational before you start your bronch, and then normally you have a portion that you would actually type your patient's information onto the screen. So if your doctor takes any sort of images of your patient's airway, it'll put all their information on that image when it prints it out. But we're missing that part, so we can't do that, so don't worry about that. Okay, so that is the scope setup portion. Then the very last stage or step that you guys will have to do is the bronch table or bronch cart setup. So that's all of your equipment. So that'll be another video.